A Chattanooga doctor has joined others in deciding he will no longer treat patients on Medicare. He blames government bureaucracy and shrinking payments for services. NewsChannel 9's John Pless is in our newsroom with a story. John.
Well, Calvin, one of Dr. Carlton Vollberg's patients sent us this letter, and it says that he has to either find another doctor who will take Medicare or choose from several out-of-pocket options that could put a squeeze on a senior's budget.
At the Eastgate Senior Center, we find plenty of people who have paid into the Medicare system most of their lives. There's a lot of uncertainty about whether they'll continue getting the care promised.
But it sends me a panic. There may not be nothing there for me when I'm 62. Now I'm asking questions and calling, and they says, well, call me next month.
In Dr. Carlton Vollberg's letter to his Medicare patients, he says he's decided to opt out of the Medicare program. He says his costs are going up, while reimbursements from Medicare have been flat. Citing the politics and bureaucracy that's tightened its grip on medicine, Dr. Vollberg said he has no other choice but to drop his Medicare patients. Here's the president-elect of the Tennessee Medical Association's take on the issue.
The physicians are looking at a 30% cut January 1st unless Congress acts. And there's not many people can run their business looking at a 30% cut in a matter of months.
Dr. Young says Congress has known about a growing funding problem for at least 10 years and uses Band-Aid fixes with each election cycle that never solve the problem. We showed Barney Witt Dr. Vollberg's letter to his Medicare patients explaining why they're being dropped.
Well, it's bad, but that's what everybody's been talking about is when this kicks in. Where are you going to go to get a doctor? Bruce Wooley just got on Medicare this spring. We asked how getting a letter like this from his doctor would affect him.
It would bother me quite a bit, especially if it was a doctor that I'd been with for quite a while. I knew my history.
While the Affordable Care Act is adding some uncertainty to the Medicare program, Dr. Young doesn't see any real solutions on the table now.
Medical care is very much becoming a political issue, and I'm afraid will only become a bigger political issue as time goes on.
Dr. Vollberg declined an on-camera interview to explain his decision to drop Medicare patients. His office did send us a statement which basically repeats what the letter to his patients says. But he is among other local doctors who either have or expect to drop Medicare patients in the coming months. Calvin?
Thanks, John.